Good evening and welcome to Born Political. My name's Joe Cruz. I'm your host for tonight. Hey, there I am. Joe Cruz here tonight, Born Political. Normally we have guests and we discuss who the guest is and we go through the 15 minutes of finding out who they are. We don't have to do that tonight. I have Mike Doyle who's with us tonight. Mike was a previous guest and we're bringing him on to talk about opiate settlement funding. He's an expert in that field. If you want to go back and look at a previous show, you're more than welcome to do it. Just look it up on Spotify or wherever you get your podcast. Look up Born Political, Mike Doyle. You can find the whole episode there, find out who Mike is. But you're going to learn a lot today. You'll know where his passion is, at least. He's a board member at Community Speaks Out. That we're both board members. And this past week, I do want to talk about the loss that we did have really quickly. One of our co-founders of Community Speaks Out, her son lost his battle with addiction after a long fought battle, but a really well-lived life. He gave back a lot. He was doing very, very good, and addiction finally got him. And we're thinking of him today. We're thinking about his family, and knowing that we still have a lot more work to do. But without further ado, I'm going to welcome Mike Doyle to the show. Mike, welcome back to the show. Thanks for being on.
Thanks, Joe. Third time now.
Third time's a charm, so everyone knows you.
I get a prize now for like a third time or what?
You do get a prize. You're not going to like it.
Yeah, just talking about James there. It's, here we are. We have, we're both board members on this organization that we're like really, trying to fight this opioid crisis. And one of the, board members' sons, so nobody's immune. So nobody's immune to it. It doesn't discriminate, so. But
Your mic's a little crooked, Mike. Yeah, it happens on us. Sometimes you can get a little technical difficulty. How's mine? Okay. All right. So in the spirit of talking about the opiates and how difficult it has been, we've lost a lot of people lately. You guys, if you're on Facebook, you see it all the time. You see these young folks that seemingly had everything going for them in life. And you'll hear people say, geez, well, they did it to themselves. And I would disagree because being involved in addiction now and really seeing what's happening in our community, this is the one disease where there's a group of scientists and huge money behind making sure that people stay in their disease. Every other disease has a bunch of scientists and people that are raising money and trying to find a cure for it. This is quite the opposite. We have people and scientists around the world that specifically are trying to come up with the next new drug that will surely hook the person or keep them addicted. It's very unique, and that's what we talk about, this opiate settlement money and why it happened, and that's what I want to touch base about first. Is why does this money exist at all? Like we talk about opiate settlement funds and we're trying to group them together, but why does it even exist?
Well, it started back with the OxyContin. Purdue Pharma and the OxyContin crisis. It started with that, with getting overprescribing of OxyContin, oxycodone, and all types of opioids that way. And what would happen is people would have like a chronic injury or a back injury or something like that. They would put them on this, and then they would keep ratcheting up the dose on that because that's where the true profit was. It's like they've got one pill, but it's got more milligrams in it. And there's a physical dependence to that. Your body actually needs and craves that. So when you don't have it, it goes in, your body goes into withdrawal.
So the lawsuit had a lot to do with, because the companies knew that it was addictive, right?
Yeah. They tried to claim that they didn't, but it came out that they really did, and that's where the lawsuit came from. Is for all the it is blood money. It's for all the people that lost the fight to the opioid epidemic here, and this is what they settled upon, and it's been distributed to every state and to every town, and we know all about it with Groton because Groton was very forward thinking and
they were.
Yeah.
Our town council was fortunate, but I think to base the premise, and so people out there that are listening to where this money comes from, because as we go on in this conversation, I think people are going to start to realize that this isn't a budget. It's not money that's taxpayers paid into something, and then they're going to look and try to get it out of the pile of the general fund. That's what happens with most things, and that's what possibly in some cases it's happening with this money, not just here in Connecticut but around the country. And when we talk about a full settlement, when you hear billions of dollars, you think that the billions of dollars is a lot of money, but when you divide that by the million people already that lost their lives and the connectivity of people that are still here, we know and have seen firsthand how your loved one dies, mom and dad, they change their careers.
Yeah.
They sometimes have to quit their job. They just can't move on with it. And it's affected the economy in ways that we can't even think about.
Yeah.
So this billion-dollar lawsuit, a multi-billion-dollar lawsuit, really doesn't amount to much per person.
Yeah.
And then it comes to down, how do you use this money properly?
Right.
And we know people have the good intentions. We just, I think, want to direct them or give them an option of good intentions.
Yeah, truly, and I think part of that, and some of it's not really a fault of the people that the money is going to. They just don't really know the areas and where they should spend it.
Exactly.
They don't have the expertise in those areas. But one thing that we've seen that's worked really well, as we've talked about before, I'm actually ending my run at Reliance Health. Tomorrow is my last day.
How many years?
8 years at Reliance Health.
8 years.
Yep, and it was
Tough position, a lot of.
Yeah, I was the director of recovery support services basically, and we did a lot of outreach work with recovery coaches who are people with lived experience that help people, with their recovery, and we did have funding for that, and the funding kind of ran out, and they went in a different direction for how we wanted to go, and when I saw this kind of happen in front of me, to the program and things like that. It kind of pushed me to where I'm like, you know what, the awareness needs to be out there of that this money is out there and it needs to be used for certain things. I think it was New York City that had put over like $20 million into their general fund to, cover budget gaps, fill potholes, fix bridges. That's not what this money's for.
It's not.
This is blood money. People died for this money.
So
it's not taxpayer money.
So collectively, and if you're out there listening, you may see this anywhere in Connecticut or across the country. If you've been affected by this, you want to make sure that your loved one, and it's not, we say blood money, but this is future blood too. We have people that are here alive and kicking. This money really is not, we can't help the people that lost their lives already. The reason that the money's been generated is because people did lose their lives, but this money really needs to hit the ground right now in places that will be effective and work. And again, I didn't know much about addiction until my son brought it to us. We don't blame folks on councils. A lot of people ran for town councils because they wanted to work on the school budget, or they wanted to either build new schools or not build new schools, whatever they went there to run for. But this is such a complex issue.
Yeah.
And the fact that it's been divided by 169 municipalities, some got a lot, some got so little that I'm sure they're sitting there feeling stranded. If they have a problem in their town, what do you do with $169, for example,
right.
like one town got? Well, we're the answer to that. Because even no matter how little or how much you got, I think, and I want to ask Mike, magic wand, boom, you have, because we collectively it's millions of dollars. But magic wand, we want to start a program or we want to spend our money. I'm a mayor of a town. What are we doing?
So as far as a plan goes, there's really like 4 areas that they should really focus on. The one that I'm a big proponent of, and like one piece of the pie on that one, is the recovery support. The people with lived experience out in the community. That has worked really well. They've called that the lived experience, the recovery coaching, or the peer recovery support specialist, the missing link in the treatment process. Okay, which is great, because what happens is that we're there before they go into treatment, or we're there to help them get to that point, get them into treatment, stay on their guest list while they're, when go and visit them. And then on the other side, when they come out, we're there too, because that's when the rubber meets the road. So that's one part of it. The other places that that the money should look, that you should look at with spending the opioid settlement money, prevention, harm reduction, treatment. I do feel like the treatment part should be a state thing. Like the state look at some of the treatment beds, the treatment facilities that we have, and being that the state sits on 85% of the opioid settlement money. That would be a great focus for, if they're not sure what to do with it, state, if you're not sure what to do with it, look at the treatment side of things and how they can improve that, how they can improve access to it, how they can improve people, affordability, how they can improve the number of beds that exist, how they can, improve like I said, the access to it. Okay, we have 3 or 4 beds, but my insurance doesn't cover this, or this doesn't, so.
I want to touch on a lived experience before we go
sure,
away from it.
Absolutely. Yeah.
Lived experience is really, I think, the focus of not just where you want to go, but it's what we at Community Speaks Out have figured out really is where the power in the organization is. Because, if you had cancer, you're not going to go talk to somebody that had cancer about what treatment you should do. You would go talk to a doctor that specialized in that cancer. This is a unique disease where, because the doctor, although they're going to prescribe stuff and they're going to talk to you and maybe talk to the family a little bit, this is truly the disease which makes it so unique. I talk to parents all the time. I'm like, this is the only parent participation disease, other than if you have diabetes or anything, and your participation may be making sure they get their insulin at the right time. Those are all structured, timely. Pretty much, you get a chart exactly what to do, a doctor's orders type of thing. There really are no true doctor's orders, and that's what makes it difficult. And did I do the right thing? Didn't I do the right thing? It's the one disease where parents and family members question themselves. Did I love them too much?
Yeah.
Did I not love them too much?
Yep.
Should I let them stay in my basement or not? It never comes up with diabetes. You wouldn't kick out a stage 4 cancer patient of your home because they were tired and sleeping on your couch, but you would in addiction. And I'm not saying what's right or wrong. I'm just saying we as community members, family members, physicians and doctors and nurses, we have to learn more about this than any other disease. And really now what we're trying to do is lived experience. If you're on a town council or you're a mayor or first select person or RTM, no matter what your role is in your local government, or if you're a community member that wants to go to that podium once a month, like most towns offer, like they do, where you can actually express what you want to see money go to, go call us. Make sure that you know that we do have an outlet. What we don't want to have happen is the money go, again, we think Narcan is hugely important, but there's a lot of people that I think once the money starts building up, and that's what it's doing, that they're going to make a choice, and the choice will be someone say, hey, just buy Narcan and hand it out. That's very effective. Yeah. It's only effective if you have a program. Right. It's like, if I just go ahead and buy 2 pallets of Narcan and put it in front of the post office, eventually you're going to throw it away.
Right. Yeah.
When Mike gives away Narcan at a training, it's because somebody went to that training because they felt like they needed the training, and they're going to pay attention, and that Narcan is going to save somebody.
Yeah. Well, and it's funny. I remember the one I did. The very first one I did at Community Speaks Out, we had like 32 people in that, and I remember about a week later getting a phone call that somebody who had taken that training saved somebody that had OD'd in the house, and it was like, I'm like, that's why we do it, even if it's just one, Yep. But the lived experience part of that, Joe, is the big the big difference maker, I believe in the in the recovery process, because you've walked a mile in their shoes, and most people get into addiction, don't get into addiction by accident, Yep. I'm in recovery myself, and yep. Everybody that worked for me while I was at Reliance Health it was in recovery, and you got a little quote unquote street cred with that, yep. where like, okay, so this person might understand a little bit what I'm feeling, with me, I can understand, that, insanity of, I know I shouldn't drink, but the next thing I know, I'm doing it, and I can't even understand why. I know with every fiber of my being that I shouldn't, and yet I am. So, but going back to how that relates to to the towns and everything like that, that opioid settlement money. And the funny part is, if you buy 2 pallets of Narcan, half of it's going to expire before it gets put out, into the world. And recovery coaches and that type of program are the ones, those are the boots on the ground in the recovery community that are out there that are working with the people that are in recovery. There's been such a focus on prevention and harm reduction that sometimes the recovery piece of it gets lost. It's great that we're doing prevention, and it's great that we're doing harm reduction, but what about the people that are already struggling with this?
Yeah, prevention can't overrule it's almost like triage. And I think, someone bus full of people get hurt, they're coming into the hospital, you're triaging people, you're gonna take the most serious. Yes, is it very vitally important that the people that seemingly have absolutely nothing wrong with them but are seen, absolutely. That'd be the prevention part, making sure that they didn't bump their head and they're going to have a concussion later. It's the person that's has lacerations all over them, is bleeding out. Those person that they need the help, and that's really almost the same way that we need to treat it. We do know that everyone has to be seen. We get that. We still understand the piece of making sure that we're gonna have a program at junior high school and talk to kids. That's important. But right now, it seems, especially now, the amount of kids that are disappearing. And if you're listening to this and you say, you know what, they did what they did, because we hear stuff like that, and Narcan, like, you know, why do we keep saving these people? I got to tell you, without some of the people that have been saved by Narcan 5, 6, 10, 20 times, I see these people as leaders in this community, and they have physically saved other people. They said the right thing at the right meeting. They changed someone's mind. They got them into recovery. And then for me to see parents that didn't have to bury their kids, brothers and sisters that didn't have to bury their brother, moms who are still going to work and part of the community and vibrant because they didn't have to say goodbye to their kid. I mean, if you can't put those things together, I think you need to come to one of our meetings and actually see it in person. And, you know, the one thing I remember is she was, I think, our good friend Inez. I'll say her name because Inez don't care. But Inez was at one of our meetings, and she shared her story. And there's a young lady just crying and bawling in the back. And there was a really good friend of ours, and she was in early recovery herself at the time. And she was I said, why were you so connected to this story? And she said, because my mom's addicted and I gave up on her. And here I am. I needed to hear this story from this woman in recovery tonight because, you know, she's as old, she's the same age as my mom. Yeah. But she has been in recovery for like this many years. So if, you know, you save that one person, it's not that one person you're saving, and it doesn't really matter anyway, because one person's worth it. It's someone. That's what we always say.
Right.
But back to like the opiate funds and settlement money. You know, like I said, 169 municipalities. It's kind of scattered. We're gonna see things, money spent very well. Like I would say the example would be Groton in my mind, where, you know, not because I'm a Community Speaks Out person, but I actually have seen the money in action. Yeah. I know what it's doing. So when you go around and you're going to talk to other towns, you're talking about possibly grouping people together. But say they say, okay, look, we like your plan. We're talking about regional. We don't think that there's one little town that needs a recovery coach sitting by the phone full time. Right. But you're talking about maybe combining a few, grouping them, and
I agree. You know, you were talking about like the one little town, they got like $169, but there's a lot of towns around there that have gotten, you know, $5,000, $10,000, $15,000. And one of the things that I think we will do is we're going to go and we're going to talk to these towns and say, hey, you know, what's your plan? What is your plan for this opioid settlement money? And offer them a plan. And the thing is, it's going to be different from town to town based on the need of that town. And we can, you know, draft up a program for them that, you know, can include working with their first responders. It can record, you know, outreach to the community, to the recovery community. It could be having town hall meetings and having people just ask questions about, you know, opioids, Narcan trainings, as well as doing overdose follow-ups. That was one of the most successful things we did in Norwich, was going out with a member of the community policing unit.
It's reinforcing, right? It's like a meeting, like I could see it in parents. Kid overdoses, gets saved by a first responder. First responder goes home. The next day, first responder puts on their belt and cuffs and pants and gets all suited up. They don't have time to reach back. Although some do, it's difficult because you still every day on the job is protecting that particular town. Right. Where the recovery coach, I think, came in, especially where you guys had the program, there's almost a wraparound, because now that the recovery coach goes and talks to the parents and says, how's everything going? Right. The recovery coach doesn't end it there. They also say, now you're riding in that cruiser and you get a phone call from a recovery coach as a police officer, and you've never got the backstory. All you know is you kept putting this person on the bus. Yeah. You don't get to hear 10 months later someone call and say, hey, by the way, that person you saved that day, they're a leader now. Yeah. They're in their house. They're actually looking to become a recovery coach themselves, or whatever they're doing. It's not just disappeared or gone. And what we've seen, at least with down here, if you're doing a job and you feel like you did a good job, you do a better job the next time. Yeah. If you're not being told that you're helping or saving somebody, it's difficult, because I think the personality of a person that's a first responder is looking for results anyway. Nobody goes there. There's certain people that just want to. If you're an auditor, and your results are at the bottom, that the numbers equal.
Yeah.
That's your result, and you feel good about it. I think if you're a first responder, you want to see a positive impact that you're having on community. And if we're not telling the story, not telling it back, and that's what part of this is.
Yeah.
You can have a recovery coach that's going to be able to tell your first responders, or say, hey, you know what? This person is still struggling. If you see them in their car and they're parked in front of their lawn, you might want to tap on their window.
Yeah.
I mean, little things.
Exactly. And, you touched on a big thing on that, too, and that's the family.
Yeah.
Because addiction touches everything. There's a ripple effect from it. You've got the person that's in addiction, and it reaches out and touches everybody that touches that person,
Yeah.
And some of the reassurance that comes from a lot of our recovery coaches, a lot of the people that we work with, we still work with their families too. There are people that we're working with now in Norwich that we've been working with since this program started in 2018. So it does definitely work. But going back to like what we were talking about as far as the the region, for the towns that have say like $5,000 and $10,000 and $15,000, it might make sense for those towns to to come together and pool their resources, and like maybe they get a 20-hour recovery coach or something like that in the town to be able to handle some of those things. Recovery's not the only bucket that the money should go in. Obviously, prevention, treatment, harm reduction, absolutely. I think are the buckets that really need to be filled up too. But recovery is the one that is the most direct to the problem right now. Think about it. What's prevention? Prevention is preventing something from coming down the line. Harm reduction is dealing with, and basically, as we said, and as you and I were talking earlier, sometimes we were just keeping people treading water, and sometimes that's what the harm reduction piece does for that. Recovery, working on recovery and recovery support, we might actually be able to take them to that next thing. The next stage or the next level.
And if you're a decision maker in your town, and you're wondering, because again, I as someone that served on a town board before, and RTM, people are going to come and ask for money, and sometimes what will seem like a great idea is just a way to dump money sometimes, and again, not through any fault of his own. I could see in the future a town manager looking at his council and saying, hey, you know what? We do have this opiate settlement funding. It's been 3 years. It's a $30,000 pot now, or a $130,000 pot. And the state's asking what we're going to do with it. Start early. Start now. Call your local groups. There could be, when I think of Recovery 12 in London and Groton, they run sober homes, and there's opportunities where that you should be taking and talking to your local. And certainly we're local. We're Eastern Connecticut and all in London County. We will certainly come out and give you ideas. And I think if you are a decision maker or a board member, we're already reaching out. We had something scheduled in Preston. It looks like Madison, maybe Monday. We're going to go around and we're going to just start talking, because if you are a decision maker, the reason you got elected was because people voted for you, knowing that if there was a problem in town to tackle, whether it was roads or whatever it is, that you were going to tackle it. And this is one that I don't think, if you let this money sneak up on you and then you're just trying to spend it because they're saying, hey, you need to spend it by this time. And right now, that from all accounts, there are no time restrictions. But I can see the urgency that happens, like, hey, we haven't done anything, and this other town's done so much. Reach across, call the mayor of Groton and any of the council members. It was a unanimous vote. No, it wasn't unanimous. It was close to unanimous, 8-1, I think, or maybe 7-2. So that creates a avenue for discussion,
right?
Where, like, reach out to your mayor, and if you're listening to this and you live in a town that's not even in our state, call them and say, "What? I saw this podcast or program, and they're talking about opiate settlement funds. Did we get any of that?"
Yeah.
Ask them, right? And because you may be able to help direct where that goes.
Yeah, you can call me and I can tell you what you got. So.
Oh yeah, Mike will know. In Connecticut.
In Connecticut, yeah, pretty much. Don't call me about anything out of here, because this is the state we live in. This is the state we work into. And I think what was amazing at our last Community Speaks Out family support group was when Mayor Franco got up and supported us and told us why she voted to give Community Speaks Out all of the opioid settlement money. and also said that she would come out to other town councils and support us and talk to them. And it's like, when you've got that kind of buy-in in a town that got a pretty decent allotment of opioid settlement money, that's huge, and that speaks volumes. So this stuff works, and it's sustainable. We can keep this going. Remember, there's 18 years of this money. So it might be a good idea to to put it in the direction.
There's towns who are going on their third year that haven't spent it, and again, it's two. I feel two different ways about it. If you hadn't spent it, it's because maybe you haven't been approached and you're not really quite sure, and that's a good thing. What will be bad is waiting too long, because people in your town are struggling and suffering. They could use this money in whatever way that it ends up being spent. We just want to make sure it's spent in the best, most efficient way, because we are up against an absolute battle that I think no one could even imagine how tough and hard it is, and we have a long way to go. I mean, again, Mike, I love having you on the show, because you always, again, when we do a presentation, to be able to take all those different components and put it together, I think that's what you're going to be good at. Like really having a vision for everyone, and not just like one silo, which is, I think, silo is a bad word in anything really, but especially in addiction. Town by town is not good.
And I think that having the ability to have that vision and be able to look across and say, hey, look, your town probably needs more of this than this here. You may not need this many hours of this, or you might need more Narcan trainings, or you might see this. You've got a couple of hotels in your town where you're seeing a lot of the transient traffic, as well as sometimes sex workers and things like that, and that to where there's probably a higher incidence of overdose. Being able to put that together, and then I don't know. At the end of the day, if you have a small amount or a smaller amount and you're not sure what to do with it, think about pooling your resources with another. We'll probably be calling you just to talk to you, just to maybe give you a few ideas, and just reach out and see, hey, what's your plan?
Yeah, we're down to our last minute, so I'm going to finish it up by thanking Mike and really coming up with the idea that you did come up with. But I'm just more excited that these towns will have this opportunity, and that's what it is. It's an opportunity. This money is money that's going to be around for the next 18 years. Again, we hope, and we will be in each of these places, just describing to people exactly what we want to do. It's worked here locally. It's worked in Groton. We've seen positive outcomes. That's what we want to bring to the other towns. So make sure, again, if you're a decision maker and you see this show, Mike's contact information has been flashing up here. And if you don't have mine, you can look it up, Joe Dela Cruz at Community Speaks Out. You find me there. We're looking to help you guys. Hopefully you guys come out and support anyone that's doing anything to help us in this battle, because it's a lot bigger than I think most people even think. And until next week, guys, this is Joe Dela Cruz, Born Political. Hope you enjoyed the show, and I hope you take action. I'll see you guys out there fighting the fight. Have a good night.